Good morning and welcome to South Bay Sunday for Sunday, September 26, 2010. I'm Sam Van Zandt. We're going to talk childcare in a little while with the YWCA of Silicon Valley. Sandy visits with Lisa Ranieri, the Child Services Director of Silicon Valley YWCA. There's a lot for moms who have to work and want their kids to get the very best while they are working. So stay around for that. We'll also talk about reading and children and why one CEO quit her job with the corporate world to help kids around the world learn how to read, and the payoff is the return to the Silicon Valley. It's all good. But first, this is an important time of year, a time when we pay close attention to a killer disease. This coming October is Prostate Cancer Awareness Month. It's a good idea to be aware of this disease and what can be done about it. Dr. Stephen Taylor is here to talk to us along with Tom Camp. Now, Dr. Taylor, why did you bring Tom?
Mr. Camp is a patient that I operated on about 1 month ago.
How'd that work out for you?
I retired about 7 years ago and went routinely and checked once a year for EKG, PSA, glucose, and cholesterol. And when my PSA, well, actually it was my bladder, I was having some issues, I was directed towards Dr. Taylor. And Dr. Taylor didn't seem to like my PSA numbers, so we followed and tracked it for a while. And I was finally diagnosed with prostate cancer. Mm-hmm. And which kind of shocked me at first when he called me and told me that I would have to go in and have a screening for my bones, check my bones, because apparently it travels from the prostate lymph nodes into the bones. That came back with good news. And then we set up a time for a schedule for surgery. I have a family member who's a doctor, and I told him initially when Dr. Taylor called me and said that he was going to I had prostate cancer, so I immediately called my cousin. Mm-hmm. And we talked about it and everything. He reassured me everything would probably be pretty good and whatnot. And then I met with Dr. Taylor, and we started talking about the procedure, and they use what they call these robotic arms, which is pretty neat. It's not from your traditional type of surgery procedure. So I informed my cousin. He called and checked in with me, and he about jumped through the phone. He was so excited about it. This procedure that Dr. Taylor did on me was so... It's less evasive. I'll let the doctor explain the procedure, but I'm a cyclist. I ride, and 4 hours after the surgery, I got up and actually walked a half mile after the procedure.
Wow.
And dragging this IV thing around the ward. Mm-hmm. A nurse there was a runner, and he had paced it off, and he said if you go 11 times around the ward in this nursing,
cardio, huh?
4 hours after the surgery, I walked a half mile. The next morning after breakfast, I walked a mile, in that circle, running the little, not running, but walking the laps. So
you didn't have much pain?
No pain. The other thing that the doctor had to deal with, I had a defibrillator put in my chest last year. So I'm sure he and the anesthesiologist were looking over at each other during this. Is he still alive?
Wow.
So,
And you went home the next day after surgery?
And doctors informed me after 4 weeks I can get back up on my bike and start riding again. And I'm looking forward to it.
That's great.
You had a catheter for about a week.
Right.
And how did you do after the catheter was removed?
Fine. It was great. You also did a thing on the urethra for the blockage, and life was much better after that.
But how typical is Tom, Dr. Taylor?
Well, it shows the advantage of prostate cancer screening with the PSA blood test and rectal exams. I've been in practice over 25 years. Mm-hmm. I remember the days before we had the PSA blood test. In those days when we diagnosed someone with prostate cancer, 90% were already at incurable stages or stage 4 disease. Now, with the advent of the PSA blood test, we detect 90% of men at potentially curable stages. So it has been a sea change for these patients with prostate cancer.
Okay, now I'm trying to understand this, and a lot of people won't, because you're the doctor, you're the patient, and we're the observers. So what I understand is, when you get checked by a doctor, you get the proctology exam, you get various other uncomfortable procedures, or you can get a PSA?
No, it's both together are better than either one alone.
Okay.
The PSA blood test by itself will detect about 80% of prostate cancers. But about 20% of men with prostate cancers have a normal PSA blood test but have an abnormal digital rectal exam. That's when the urologist inserts a finger and checks the prostate and feels its texture.
Right. So why has the PSA come under fire from some critics?
People are critical of it because it's not 100% perfect. Urologists never considered it 100% perfect. It was a piece of a puzzle. It was just one little facet. We look at the patient as a whole. We look at what symptoms he has, how the prostate feels, how the PSA has changed over time. So a PSA all by itself is only one little bit of information.
How has that changed for you over the years? How long have you used the PSA? And, as a doctor, it's got to be, especially dealing with oncology, it's got to be kind of a tough field in a lot of ways. How has, say, your life as a doctor improved, your outlook with regard to patients and their outcome?
PSA first was developed in 1987. When it first came out, we didn't quite know how to use it. It's like someone gave you a Stradivarius violin, and it took us years to figure out where it fit into the evaluation of patients with prostate problems. But over the past 23 years, we've learned a lot about it. I remember the days when we did open prostate surgery. The recuperation was much longer than my patient here had. It would take weeks to recover. Now with the robotic surgery, the Da Vinci robot, we can have patients recover as quickly as Mr. Camp has recovered. It's really absolutely dramatic.
Da Vinci robot.
Yes.
It sounds like something based on something that Da Vinci might have drawn.
It may well have done.
So how's your life now? It's just been a few weeks, but you must have gone through quite a bit in the last few weeks.
It's great. You have to remember, there's the initial shock, and then the discussions I had with the doctor saw me through. So I was pretty optimistic that things were, going to work out pretty good. And if they didn't, just move on with your life.
Yeah, as best you can.
Yeah, right. You're not going to sit around and mope about it. So, total defiance, if you will. As my attitude towards cancer is.
You must feel fortunate that you had the right physician at the right time.
Yeah, I give a big hug to my primary directing me towards Dr. Taylor.
It's great to hear a good story like that. And I asked you about, Doctor, about how things have improved over the years, and we keep coming back to the PSA. Why is that so important to you? Is it something that is at risk?
Well,
the use of the PSA?
Again, people complain about it because it's not 100% perfect.
Yeah.
There are no 100% in medicine.
Right.
But as I said, the PSA is simply a piece of the puzzle. And if you have a good urologist, he'll put the pieces together and a picture develops. We've been doing prostate cancer screening at our hospital in Walnut Creek for almost 19 years. Every September we offer free PSAs and free rectal exams. And what we found is that the patients who come in for their initial screening, 1 in every 20 men will be found to have cancer. And these are men that would never have known that they had it. Once you've had the initial screening, if you keep coming back every year, your chances of being diagnosed with prostate cancer is only about 1%. So the initial screening is the most important. There have been 2 recent very large studies on PSA screening. One was done in Europe, where the screening was only 1 PSA every 4 years. Mm-hmm. And just the men who went through that screening process, they reduced the prostate cancer death rate by 20%. And that's without rectal exams and without yearly PSAs.
It's a simple procedure. It's nothing that would be difficult for us to undergo.
PSA is just a simple blood test. It stands for prostate-specific antigen. It's not specific for prostate cancer, but it is specific for the prostate.
You mentioned getting one early because it gives you your frame of reference, I assume.
Correct. And we're now advocating starting screening at age 40 for young men. It's very important for men with positive family histories of prostate cancer. If a brother or your father had prostate cancer, your chances of developing it are much higher than the general population.
I see.
Once you've had that initial screening, we then can decide on the number and the way your prostate feels, how often you need to be rechecked. If your numbers and exam come out very favorable, you might not need to be checked for a few years. If there's some concern, we might see you more often, once a year.
How about you, Tom? Did you give him a frame of reference? Had you been doing the PSA for years, or were you just lucky?
Periodically, back when I was 40-ish, it was a panel. It was
Right.
EKG, your prostate, sugar, and whatnot. Anytime. It was just a full panel, I guess, of checking, for the blood. But I was shocked to find out of my own, the number of men are 50s, early 50s, that are having this. And when the doctor just mentioned 40, that really makes a lot of sense. Because in my own research about prostate cancer, we're all going to, no matter what age we're going to be, we're going to have prostate cancer. So
Really?
From what I've read and seen, at some point, if you live to be in your 90s, from what I've seen, you're gonna have to have this problem.
Mm-hmm.
I'll refer to the doctor on that, but I think it made me more aware of it after I went through this whole procedure and process. So, and I became as I told Dr. Taylor, a big advocate of this. Awareness. It's not that big a deal to find out.
Right, it's nothing really. I mean, it's part of your annual exam.
Really, and it's not like going for a colonoscopy, which is a little different.
Yeah, exactly. That's what guys back away from, pardon the pun. It's a colonoscopy. And a lot of HMOs don't even recommend that till you're 65 now.
Colonoscopy?
Yeah.
I think they recommend it once a year, every 10 years, starting at age 50.
Yeah.
If you have a normal exam, then every 5 to 10 years.
So, over the years, modern medicine, it must be pretty amazing to you to see the progress that's been made in saving lives like Tom's.
It's the changes have been absolutely dramatic, not just for surgery, but there are advances in radiation therapy as well. In the olden days, over 10 years ago, we used to see a lot of side effects from radiation therapy. Now the technology has improved dramatically, so we see much fewer side effects, and hopefully that will translate to a better quality of life and better outcomes for patients who do undergo radiation therapy. When someone is diagnosed with prostate cancer, we don't automatically take them to surgery. We have a discussion. And some men opt for watchful waiting, which is active surveillance, where we keep a very close eye on them, but delay treatment a few years until things progress. Some men opt for surgery because they want it out. They want the problem solved as soon as possible.
And Tom's nodding his head, so that must have been his option.
Yes. And fortunately, the technology with the Da Vinci robot has improved to the point where men get through that so much easier than with the open operation. It's just night and day quicker recuperation, faster return to all normal activities and bodily functions. Some men are afraid of surgery and want something less invasive and opt for radiation therapy. And as I said, there have been major advances in that as well.
Uh-huh.
And some men are so old and too many other medical problems, shorter life expectancies, and they don't need any treatment at all. We just keep an eye on them.
They just progress. And you mentioned progressing. That's inevitable, I assume, once it's been diagnosed.
Prostate cancer in general is one of the slowest growing cancers. It grows very slowly. So if someone has less than a 10-year life expectancy, generally they don't need active treatment, they just are monitored. But some cancers are more aggressive and do grow more quickly and are more dangerous. And so we do recommend action in those patients.
Yet the ones that make the headlines are the prostate cancers that apparently moved quickly and took the life of somebody married to somebody famous or somebody who is famous and that sort of thing. Is that just a rare occasion?
No, there are some prostate cancers that are more biologically aggressive.
Oh, okay.
When someone has the elevated PSA or a abnormal rectal exam, it leads to a biopsy. And the pathologist can give us a score on that biopsy from 2 to 10 that tells us how aggressive this particular prostate cancer is.
Okay.
And based on that number, we can make recommendations regarding surveillance versus active treatment.
So let's pretend I'm 40 and I'm listening to this, and I want to know how I can best protect myself against prostate cancer. What's your advice?
So, number one, there's prevention and things that you can do to try and prevent prostate cancer. Some people believe in lycopenes that are found in tomatoes, watermelon, and grapefruit. There are actually 2 prescription drugs on the market today which have been shown to reduce the development of prostate cancer by about 25%. So if someone has a family history of prostate cancer or is at higher risk, we may elect to start them on one of these prescription medicines to try and prevent it. But as Mr. Camp said, almost everybody's going to get it eventually if they live long enough. Mm-hmm. So if you want to prevent a death from prostate cancer, early screening, yearly PSAs, yearly examinations by your physician should help reduce the death rate from prostate cancer.
Get with your doctor, huh? Congratulations, Tom. What's next for you?
Get back up on the bike, move on with my life, and enjoy.
To your good health. Thank you for coming to tell us your story.
Oh, thank you for having me.
Dr. Tater, thank you too.
You're welcome.
And up next on South Bay Sunday, some peace of mind for working moms. Sandy talks to the YWCA of Silicon Valley when South Bay Sunday continues.